Hey, I'm Ashish, and I will talk about how we can facilitate self-guided mental health interventions through human language model interaction. So this work was done in collaboration with Kevin Rushton and Theresa Nguyen from Mental Health America and Inna Lin and Tim Althoff from the University of Washington. So the world is going through a mental health crisis. This is in fact a 5-year-old start, and even back then, 1 in 5 adults were struggling with a mental illness, and only half of them received any form of treatment. And with the ever growing need, also after the COVID-19 pandemic, it is becoming more and more difficult to find a therapist. So this brings the question of how can we ensure accessible mental health care for everyone? So one promising approach to improve access to mental health support is self-guided interventions. So people often seek out self-guided resources to learn about mental health and to practice mental health skills. So these self-guided interventions can take many different forms. So there are DIY tools, worksheets, and even psychoeducation content. For instance, a worksheet that can help you identify and overcome your negative thoughts by asking you to reflect on them through questions like, let's say, where does this negative thought come from? And there are many similar interventions being facilitated by hundreds of different mental health organizations. But turns out that engaging in these self-guided interventions without the help of a therapist can be cognitively and emotionally challenging for people who are already dealing with mental health issues. So currently what happens is most of these self-guided interventions, they will simply take a traditional manual therapeutic worksheet and they will transform it into a digital online format where you take, a paper worksheet and transform it into this online format through questions and a form. Now, several works have shown that such solutions provide limited instructions and support, and using these type of digital worksheets without a professional support can lead to cognitively demanding and emotionally triggering experiences, which will ultimately limit your engagement and usage. So in this paper, we see human language model interaction as an opportunity to support self-guided mental health interventions. So we ask, can language models help people learn and practice cognitively demanding and emotionally triggering mental health processes? So here we take cognitive restructuring as a case study. So cognitive restructuring is this proven therapeutic technique which can help us in overcoming negative thinking patterns. So in cognitive restructuring, what you do is you will challenge a negative thought with a different, more balanced reframe thought. So such a practice is something which is core to cognitive behavioral therapy, which is an evidence-based therapeutic intervention. So for instance, let's say a PhD student like me is struggling with their research project and they starts to worry, I will never complete my PhD. Now, in order to reframe this thought, first what we can do is we can help them identify the thinking traps that their thought have. So for instance, the thought might have different distorted patterns of thinkings, which is why it might be emerging. For instance, let's say this particular thought is falling into catastrophizing, which is thinking of the worst case scenario. And it's also falling into fortune telling, where you're trying to predict the future. So based on this thinking traps, what we next try to do is write a reframe that addresses these thinking traps. So for instance, in this case, one way in which the student can reframe their thought could be to say something like, I'm imagining the worst case scenario. This particular project did not work out, but I was able to formulate meaningful hypotheses for my next research project. So in our paper, we study how cognitive restructuring can be supported through human language model interaction. So we used Mental Health America, or MHA, for our study. So MHA is this large mental health website that provides mental health resources and tools to millions of online users. Many of these MHA visitors are interested in mental health resources, including self-guided interventions. And this sort of setup helps us in conducting our study in a human-centered and ecologically valid setting. So in total, we had 15,000 participants. Our design process was based on various randomized trials, where what we do is we compare different design decisions based on feedback that we receive, especially from users of early prototypes. And finally, one of the key parts of our design process also involves evaluating the safety and risks associated with our system, which is something which is critical, which I will talk about in a bit as well. So we look at 3 research questions, and let's look at them one by one. So first of all, we ask, how can we design a self-guided cognitive restructuring intervention that is supported through human language model interaction? So to answer this question, we formulate a design hypothesis through a series of steps that involve incorporating qualitative feedback from users of early prototype of the system. Also then sort of brainstorming on design decisions with mental health experts, and finally leveraging relevant insights that previous mental health studies have provided us. So our first hypothesis was that assisting participants in processes that are cognitively challenging and emotionally triggering may improve the overall intervention effectiveness. So cognitive restructuring involves several steps. For instance, identifying your thinking traps, and such steps may be cognitively challenging and emotionally triggering for many people, something which psychotherapists have also shown in previous studies. So in fact, many participants in our design exploration phase also highlight these challenges and how they often struggle with formulating these thought to situation to thinking trap to reframe type of scenarios by themselves. How it is hard for them to think about reframes on their own and in the moment. And how they often have hard time sort of figuring out the cognitive distortions that they are using in their thought. So here what we do is we support participants through these type of challenges through a language model. Second, we hypothesize that contextualizing thought reframes through things like situations and emotions may improve the intervention effectiveness. So cognitive behavioral therapy has sort of shown that our thoughts are shaped by our situations, subsequently sort of influencing our beliefs and emotions, and which is why the ability to reflect on situations and emotions and recognizing their connections with negative thoughts could be beneficial in accurately assessing thinking traps and writing effective reframes. Also, cognitive restructuring is a skill that people can actually learn, and learning how to perform restructuring can help people in developing this ability to reframe their negative thoughts as and when they will have it, for instance, in the moment. But acquiring this skill is not that straightforward, and it typically requires comprehensive psychoeducation coupled with practice. So for instance, learning about strategies to overcome different thinking traps that their thoughts have. So in our study, we aim to introduce participants through such psychoeducation with things like the definitions of the thinking traps, examples, and strategies to overcome them. We also found that participants of early prototypes of the systems desired the ability to have different types of AI suggestions. For instance, actionable suggestions as part of their reframes, and sometimes even the ability to write the information and revise it as many times as possible. So we aim to facilitate such interactive refinement of reframes as part of our design process. And lastly, the need for safety considerations is also crucial when intervening in high-stakes settings like mental health. So mental health experts have argued that LM-based interventions often have issues related to participant safety. And in this case, we aim to design mechanisms which can avoid unsafe content generation and which can also flag any inappropriate content that may make these interventions unsafe. So based on these design hypotheses, we develop a system that can help people in overcoming negative thoughts. So the idea here is straightforward. What you do is you ask people to go through various steps of cognitive restructuring, and you provide language modeling based assistance wherever you think like it's appropriate. So the first of this step is a thought. So here it asks me, what negative thought are you struggling with right now? So in this case, I was struggling with this thought, I will never achieve success as a researcher, which is something I can enter into the system. Now, in order to provide additional context about this thought, it asks me about my emotion and my situation. So in this case, I was feeling discouraged and maybe my emotion strength was 8 out of 10. The next question is, what's a recent situation that led to this negative thought? So for me, the situation that led to this thought was I submitted a research paper and it got rejected. So now that we know the thought, situation, and the emotion, we try and help the user identify the potential thinking traps that their thought might have. And instead of asking the user to choose from a long list of 15 different thinking traps, the names of which they would have never heard, what we do is we first develop a model which can filter these thinking traps and then show those to the user along with their likelihood. So I can choose the thinking trap I most resonate with. So here I agree that I'm overgeneralizing based on one single instance of paper rejection. So I choose that. Now, depending on this thinking trap, we try and help the user to reframe their thought. And once again, instead of giving them an empty text box and asking them to come up with an initial reframe on their own, which is known to be challenging, what we do here is we provide them options. So using a language model that we build, we generate multiple possible reframing suggestions that may address the thinking trap that the person had. So some of the suggestions here are, let's say, it's normal to feel disappointed when something doesn't go as planned. I can use this experience to learn and grow. And there are other suggestions as well. So I really like this suggestion maybe, so I can choose this as a starting point, which is something which I can then work with. I can continue editing it. I can sort of get more help on this reframe in that interactive and iterative fashion that I talked about earlier, for instance, to figure out the next steps and actions and maybe to make it more empathetic and so on and so forth. So the big question for us was, does the system actually help? And to study this, we collaborate with mental health experts, clinical psychologists, and advocates. So we deployed our model on the Mental Health America website, and we conducted this large-scale randomized field study, which had actual MHA visitors with lived experiences as participants. So here I will talk about results that we had from over 15,000 participants. But overall, we are immensely grateful for the feedback that we have received from over 120,000 participants till date. Part of deploying this tool was also to analyze the potential benefits and risks it has to its users. And here I want to highlight the various ethical and safety considerations that we undertook. So we co-designed with stakeholders to identify and minimize risks. So this includes people with lived experiences, clinicians, mental health experts, and advocates. We use established principle-based ethics frameworks that people have developed to develop interventions in such high-risk settings. We also obtain informed user consent from our participants, and our study was thoroughly reviewed by our IRB. We develop methods which can filter inappropriate and unsafe content, and we also do a collaborative stress testing on potentially harmful examples that such a system may see. So now that we have the design of our system, we look into its effectiveness. So we look at to what extent does human language model interaction-based cognitive restructuring help individuals in alleviating their negative thoughts and overcoming negative thoughts. So how do we know if the system is effective? So psychotherapy research in CBT has suggested us that for a reframing and restructuring process to be effective, it must help the people in reducing the emotional intensity. The reframe must be relatable to the individual, be helpful in overcoming the negative thought, and memorable enough to be accessible if you have the same thought the next time. And finally, this process should also help us learn the skill of cognitive restructuring so you can apply it on your own. So first we look at the overall reduction in the emotion intensity before and after using the tool. So the x-axis shows exactly that, reduction in emotion intensity. So a positive number here means that you have a positive change in emotions after using the tool. So here what we find is that the tool has a positive effect on the emotion of over 67% participants, which is something which was really, really exciting for us. We also find that this system helps over 80% participants in terms of the relatability of the reframe. 65% participants find the reframes helpful, 70% find the reframe memorable, and then 67% participants report that they learned how to reframe their future negative thoughts through such a system. And finally, if we look at the equity of our system, we know that AI-based systems are disparate across different populations. So here we ask how equitable is the intervention that we develop and what strategies may improve its equity. So here we tested the outcomes of our intervention across people of different demographics and people expressing different types of issues. We particularly found that adolescents with age group between 13 to 17 report significantly worse outcomes with significantly lower reframe relatability, reframe helpfulness, reframe memorability, and skill learnability. Now, this is important because this is also the population which is more likely to engage with digital interventions like ours. So what we do is we try and see how we can improve the outcomes for them. And we do that by adapting our reframe generations to adolescents. So in our analysis, we observed that adolescents write thoughts and reframes with lowest levels of reading complexity. So what we do here is we try and make the reframe easier to understand and more casual for such population using a simple GPT-4 based prompt. Turns out that it does work with significantly better results on reframe relatability and then reframe helpfulness as well. So to summarize, self-guided mental health interventions can improve access to mental health support, but they are also cognitively demanding and emotionally triggering. So a study which had over 15,000 participants on MHA suggests us that these type of human language model interaction systems may help people in self-guided mental health interventions, which is something that we show through many different type of analysis that we conduct, including the effectiveness and the equity of the system. I thank you so much. I once again want to thank my collaborators, and you can try out the system that we develop online, and I will see you all at the conference. Thank you.